Let's talk about fractures today and what you have to do when there is a fracture. I'm Dr. Melanie Amarasuriya, consultant orthopedic surgeon. Let's talk about fractures. When there's a fracture in a bone, following an injury, an accident, or a fall, patients do feel a lot of pain. There's massive amount of energy transmitted into the body before a fracture occurs. And there's a lot of associated soft tissue injuries, skin contusion, bruising, hematomas, and pain. So that can lead to a lot of swelling, pain, and difficulty of functioning of that limb, the hand or the leg or that part of the body. So in this instance, first aid is very important. Painkillers will help the patient to relieve the pain, and then keeping the affected parts still using a splint or a brace is important because it will prevent secondary injury. When the fractured bone starts to move, it can cause further injury to the soft tissues. So it's essential that we don't allow unwanted movement in that fractured limb. And then we can keep that part elevated to prevent further swelling. It's important that we seek medical advice. So when a patient comes to the hospital or to an orthopedic surgeon with a fracture, what we do there is to keep that broken bones in alignment so that it heals in good alignment. The time that takes for a fracture to heal is about 4 or 6 weeks depending on your age, depending on the part of the body that's fractured. And there's nothing we can do to expedite it. What we essentially do is hold it in good alignment so that it heals in a proper position. So we can do 2 things to help it heal in good alignment. One is having an external device like a plaster of Paris cast or a brace. The second thing is doing a surgery. Surgically, we can use metal rods or plates or screws to fix that bone in place in a good alignment. Either way, what we essentially do is hold this bone together so that it heals in a good position over a period of 4 to 6 weeks in general. And once the fracture heals, all these external devices or metal work becomes redundant. If it's a plaster of Paris cast or a brace, of course we can remove it. But the metal work can retain inside your body. They are inert and they don't cause any trouble. So to avoid further surgery, we let those metal work stay inside the body long term without any trouble usually.
Kings නිරතුරු විශ්වාසයෙන් ඔබ ළඟ රැඳෙන්නම්.